And turning now to Venezuela, where the search for survivors has largely become a recovery effort, as authorities face the additional challenge of recovering, identifying, and burying thousands of victims. At least 2,000 people are dead, according to the government, and more than 50,000 are missing after last week's massive back-to-back earthquakes. Still, families and rescue teams are digging day and night to find their loved ones and clinging to moments of hope. Today, 8 days after the earthquake struck, a security guard was rescued from the rubble of the 7-story building where he worked. Rescue teams were able to keep the man alive by passing him water and food through a hose. But public anger is growing, as critics say the Venezuelan government's response to the disaster has been too slow. Many countries, including the U.S., and international aid organizations have deployed resources to assist with the disaster. Joining me now from Caracas is Claudia Manresa, the regional manager in Venezuela for the international aid organization Project Hope. Claudia, thank you again for joining us, and thank you for all of your efforts there on the ground. Tell me about Project Hope and the work that you're doing right now in Venezuela.
Thank you for having me, for giving me this space to speak about what's going on in Venezuela. Project Hope is a humanitarian organization with more of 70 years of experience in implementation of health program, emergency response program, and humanitarian programs. We've been in Venezuela since 2019, supporting over 55 healthcare facilities around 8 different states of the country. Our medical staff has been working non-stop since the earthquakes. Last week, we have delivered pallets of medical equipment, supplies, and medicines to the main emergency networks in the most affected states, Distrito Capital, Miranda, and La Guaira. We have also provided first aid, psychological first aid to the survivors and to all the people affected by these earthquakes. And we have also distributed aqua taps to secure safe drinking water for over 250 families.
And Claudia, what sorts of challenges or limitations are aid workers like yourself on the ground experiencing when it comes to delivering or providing aid?
It's heartbreaking what we're seeing on the streets. So as a Venezuelan, it's really hard to see your own people suffering. We have been able to coordinate with the health authorities in Distrito Capital, Miranda, and La Guaira, which were the most affected states by these earthquakes. But we are running short of supplies, and we will run out of supplies very soon. So we need the support of the international community, and of course, so everyone who can donate to Project Hope. You can visit projecthope.org and make your donation to help us support the persons that are affected by these earthquakes.
I know Project Hope conducted a rapid needs assessment following the earthquakes. Can you tell us what the key findings were from that assessment, and what are the biggest needs in Venezuela right now?
Yes, hospitals and basically all the healthcare facilities remain overwhelmed. At least 57% of the healthcare facilities that we have visited are facing power and a water outage. We also have been able to coordinate relief hubs with our team continuously. The priority needs are clearly identified. We urgently required medicines and medical supplies for primary healthcare facilities, IV solutions, surgical supply. There's also a critical shortage of pain medication, antihypertensive, glucometers, hygiene kits, and safe drinking water to also prevent secondary health crisis.
The report also details pre-existing vulnerabilities in Venezuela prior to the earthquake. What are those, and how do they complicate ongoing efforts?
Yeah, so as I already said, Venezuela already faced overwhelmed healthcare system. So of course, this crisis, it's really critical. We have more than thousands of people that are still looking for their loved ones and their family members, and we're still seeing thousands and hundreds of people looking to receive medical attention. So this tragedy joins to an already overwhelmed healthcare system. And we have been trying to support the primary healthcare facilities since 2019, but it is a major crisis, and it is devastating what we're seeing.
And the disaster has also had an especially hard impact on vulnerable groups of people, including pregnant women, children, people with disabilities. What specific challenges are those groups facing in the wake of this disaster?
We have seen a lot of pregnant women starting to deliver their kids on the street. So we're trying to respond to that also with kits for the women. It is really hard for them to receive medical attention at the moment, and that's why we're also providing mobile medical units to support the people in need and to support also not only kids that have survived through this tragedy and pregnant women as well.
And lastly, if people would like to donate, where can they do so?
You can visit projecthope.org. That's the website of the organization. There you can find the campaign. We're raising funds to keep providing medical assistance, NFI kits, and medication to those in need. So please visit projecthope.org and you can make your donation now.
Claudia Manresa, thank you again for your time, for all of your efforts, and please stay safe.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.